His name is Ian Young. He is standing right there. And I'm awkwardly going to read his bio. He's one of our very good friends at PAA. And he's an advocate who is never afraid to speak out or talk back to me. After becoming permanently disabled in 2004 and spending 11 months hospitalized, he felt he had to give back to an unfortunately marginalized community. Starting small, he educated himself, sought nonprofits to be a volunteer member of and from. He keeps aware and informed on the civic, provincial, and federal level. And his mantra, which I love, Ian, is, as one, we are a voice, as two, we are a concern, and as a group, we become an action. And that's his motivation. Thank you.
Thank you, Perilous Times and Public Interest Alberta, for the opportunity to be heard. It means a lot to my community to be among those who listen. Thank you for Teresa McRowich, the Voice of Alberta's Disabilities, with getting me here today. And to everyone here, it's truly an honor to be on you. I am not a politician, but a disabled aging Albertan, concerned for myself and others while aging, being disabled, and our future. I have seen firsthand the deplorable treatment by the most vulnerable by the UCP. Sadly, what brings me here is fear. I fear the direction of our current government. I feel that others and I have no say in our future. No consultation, decisions made for us, minimal choices for our needs, accommodation, and continuing cuts to our programs. I think they don't care. They see us as a burden. We have most of our lives. We have contributed to our province and our country. It is not a trusting government to cut our benefits and opportunities and in the same breath give themselves a raise. I'm tired, I'm exhausted. It was 2004 when I was suffered a major setback that kept me hospitalized for 11 months. Being nonverbal from my setback, I was very observant. I had no choice in being sent to long-term care, which I paid for. That depleted any money I had to be neglected, humiliated, and abused daily. And an incompetent doctor giving me a 10-minute assessment, not knowing my nerve disorder, and telling me I would never get better. Enough about my past. Let's look at our future. Sadly, when the UCE rain, it does not look good. Our golden years look more like our golden years. This is an opportunity to gather here together, be heard. We have to get clarity. We have to get funding. We have to get honesty, which does not mean that my way is monstrous. Yes, I said monstrous. As we age, we just really want to relax, enjoy life, and feel secure. Again, I am very thankful for agencies like Public Interest Alberta and Friends of Medicare. Seniors advocates and mentors like John and Carol Wodak, whom I respect and admire, and I'm grateful for what they've done for MSC. What led me here was a few things. Became disabled at 14. My life was turned upside down. I'm in a state of being nonverbal and no mobility. Fortunately, a very forceful sibling, my eldest sister, professional, well-educated, and experienced, from having dealt with bureaucracy for fighting for her son's care and education opportunities. Some people don't have that privilege of present to a system, which leads to vulnerability. It took a life-changing episode for me to finally get the treatment and care I deserved. I got to a catatonic state as I could not get a proper GP due to healthcare cuts by government that balanced the budget but at the expense of the public. Even went to emergency room and waited 14 hours, but I was turned away. The neurologist I was to see had gone for the day. And the overworked staff halted over and over. It was not their fault. They were overworked and underpaid. We set an appointment with me with the neurologist. It was 4 days later that I was able to see her. Finally, I got a CAT scan. She told me it could have been prevented. An active treatment would have been right away. But guess what? No beds. So finally I had a diagnosis, but a 14-day wait and no treatment. How broken up a system is that? I was finally admitted to the Foothouse Hospital in Calgary. Things got worse. But I had a beach town nearby. As I was hospitalized, the nurses and doctors were amazing. I was busy and underpaid. So, 7 strokes later, I was preparing for the worst. I thought I was preparing for the end of my life. So was I. My sister battled the bureaucracy and advocated hard to get into the University of Alberta Hospital because all my family was in Edmonton. The complications then? No. But finally, I had professional experience to help. I'm grateful to every professional who, although overworked and underpaid, gave me care. Then, when it was decided, not by me, or my family, or my care staff, or my doctors, I was shipped to long-term care. I saw the chaos of how the system and how it affects everyone, the patients and the families. And I realized, with my recovery comes responsibility. My ancestral Scottish stubborn blood boils, and I knew I had to be our voice for the voiceless. I contacted my MLA for my board, David Nager. The housing I was released to was unsuitable, not just for me, for all of other vulnerable residents. It was a pivotal moment. The outstanding MLA and his office staff encouraged me to tell my story and introduced me to an outstanding community, which led me to more opportunities, speaking engagements, and recognition. I even arrived at our nation's capital to speak. After receiving a gift from two MPs from British Columbia and Quebec, I took a train. I took the rail train from Vancouver to Montreal to the stopovers where I spoke, and a voice mechanisms, then on Ranger. People I spoke to listened. I was able to pay back the hope resources I had discovered, which expanded me to supporting more issues. I don't do this for me, I do it for us. We have each other's backs. We share concerns, and we will not be silenced. But telling your story is beneficial, as our current government doesn't listen to us. They only benefit themselves. They make decisions that affect our lives, but they don't include us. That is not support. That is dictatorship. Then they try to intimidate those who speak out with fear of retribution. There are a lot of us who will listen and speak out. We're here to support each other. So consulting with us, as the Honorable Marie Renew did when she administered seniors, community, and social services. And as the opposition critic, she includes us by informing us, urging us to speak at our comfort level, keeping very involved in forums, workshops, and keeping with the slogan we adopted, nothing about us without us. Now the minister presently holding that title doesn't communicate, involve us, or attend forums, just making cuts and programs without consultation. Touching on that, with the community there now choosing a new program for AISH, which is assuring persevering handicap. AISH is, we call the program ADAP, Alberta Disability Assistance Program. To say information on this program today is an understatement. And in consultation with the community, my understanding was zero. So as the community panics about what is going to happen next, we feel very confused and distraught. What we do know of the program, they will have a team of doctors appointed by them to assess our eligibility to be employed. We're not our doctors who are professionals who have signed the papers in our first place for the eligibility for age. The doctors who specialize in our disabilities, the ones who have worked with us for years. There are work programs and agencies throughout Alberta and support persons with disabilities who want to be employed by coaching, working with the people on individual basis, bringing a sense of reliability, self-esteem, and choices, following them and informing the employer of clients' needs and contributions. So there are many programs in place. I know 3 Alberta programs UCP got funding for with very limited notice. Why bring in an invention program by the current government when they're already available? It doesn't make any aggregate sense, and they're not opaque. Just posting on the website, more information will be available, which is not progress support of the local community. Accommodation for an accessible workplace is not in Alberta is not a priority for UCP. The Alberta lacks the Provincial Disability Act. Our current opposition was working on one. The UCP scrapped. The legislation will make a lot of sense. If you want to get us in the workplace, accommodate us. And not make confusing statements that just puts vulnerable people in fear of their well-being and their finances. The current disabled transit can't handle the clientele this far down to get people to enroll. People will collapse with overflow. Employers have scrambled to understand accessibility. There's not enough information, and it's confusing and heartless to an already vulnerable community. But again, they give themselves a raise. How can we trust a government that has proven to be liars, unpatriotic, and is under investigation by the RCMP? And this is just it. After many years of hard work, federal disability support groups worked hard to get a federal disability plan. This work by dedicated advocates took a long time. And we were a bit disappointed it was only going to be $200 billion. But it was a start. It's set to roll out in July across Canada. This is federal, not provincial. The UCP has been subject to declaration by $200 for this goes on. This was announced on the 21st, last Friday. How low can you go? I remember the televised debate in 2022 between the Honorable Rachel Lawley and Daniel Smith. And Danielle blurted out, "Judge Mootsing is your boss, Ms. Lawley." Then followed with, "The people of Alberta are my boss." Danielle, that is true. Like your friend who is selling lies, misinformation, and talking of a takeover of our country, when you visited Florida more than your constituents, and you were participating in events promoting his harmful rhetoric, a person who was threatening our county who I never thought I'd ever quote, Perilous. Danielle, you're fired. Thank you for your time, support, and listening today. It means a lot. Even though I have an impaired speech, I'm like to have a voice. If we wouldn't gather here to be the real freedom fighters. Always have them.